Question 1. Governance review demonstrates that a certified dental assistant, CDA, is tasked with describing the primary differences between central and lateral incisors to a new dental student. Which of the following descriptions most accurately reflects the functional and characteristic distinctions relevant to dental assisting practice? Option A. Central incisors are generally larger and wider with a more prominent cingulum and incisal edge, primarily responsible for initial cutting and tearing of food, while lateral incisors are smaller and narrower, assisting in guiding the mandible and contributing to the overall aesthetic contour of the anterior arch. Option B. Central incisors are characterized by a pronounced lingual fossa and a single thin root, primarily used for grinding food, whereas lateral incisors have a broader crown and a bifurcated root, mainly for shearing. Option C. Lateral incisors have a significantly longer root structure compared to central incisors, making them more prone to mobility, and their primary function is to anchor the dental arch. Option D. Central incisors and lateral incisors are functionally identical, differing only in their position within the dental arch, with both serving equally in the initial breakdown of food particles. Correct answer is A. Central incisors are generally larger and wider with a more prominent cingulum and incisal edge, primarily responsible for initial cutting and tearing of food, while lateral incisors are smaller and narrower, assisting in guiding the mandible and contributing to the overall aesthetic contour of the anterior arch. Explanation. This scenario presents a professional challenge because a certified dental assistant, CDA, must accurately identify and describe dental anatomy, specifically incisors, based on their functional and characteristic differences, while adhering to the strict regulatory framework governing dental assisting practice. Misidentification or inaccurate description could lead to miscommunication with the dentist, improper treatment planning, or patient misunderstanding, all of which fall under the scope of professional responsibility and regulatory compliance. The challenge lies in applying theoretical knowledge of incisor morphology and function to a practical context, ensuring the information provided is precise and relevant to patient care within the established legal and ethical boundaries of the CDA role. The correct approach represents best professional practice because it demonstrates a thorough understanding of incisor anatomy and function, aligning with the CDA's scope of practice as defined by regulatory bodies. Specifically, it accurately differentiates between central and lateral incisors based on their key characteristics, size, shape, root length, and their primary functions in mastication and aesthetics. This precise knowledge is crucial for effective communication with the supervising dentist, assisting in diagnosis and educating patients. Adherence to these anatomical and functional distinctions is implicitly required by the CDA's certification and the ethical standards of the profession, which mandate competent and accurate patient care. An incorrect approach that fails to distinguish between central and lateral incisors, or misattributes their primary functions, represents a failure to meet the fundamental knowledge requirements for a CDA. This could lead to diagnostic errors or ineffective patient communication, potentially violating regulations that require dental assistants to perform duties competently and under supervision. Another incorrect approach might oversimplify the characteristics or functions, neglecting important variations that could impact treatment decisions, thereby failing to uphold the standard of care expected of a certified professional. A third incorrect approach might introduce information outside the scope of a CDA's responsibilities, such as diagnosing or prescribing, which would be a direct violation of regulatory boundaries. Professional decision-making in such situations requires a systematic approach. First, recalling and applying foundational knowledge of dental anatomy and physiology. Second, considering the specific context of the patient's needs or the clinical situation. Third, communicating information clearly and accurately to the supervising dentist and/or patient. And fourth, ensuring all actions and communications remain strictly within the defined scope of practice for a CDA as outlined by the relevant regulatory framework. Question 2. Operational review demonstrates that during a routine appointment, a patient's spouse approaches the dental assistant in the reception area and expresses concern about a visible lesion on the patient's tongue, asking for details about its diagnosis and treatment plan. The patient is currently in the treatment room with the dentist. Option A. Ask the patient for permission to discuss their condition with their spouse while the patient is still in the treatment room. Option B. Immediately inform the spouse about the diagnosis and treatment plan for the lesion, as the spouse is a concerned family member. Option C. Politely inform the spouse that you are unable to discuss the patient's medical information without the patient's explicit consent, and suggest they speak with the patient directly about their concerns. Option D. Provide the spouse with general information about common tongue lesions and their potential treatments, without confirming if the patient has such a condition. The correct answer is C. Politely inform the spouse that you are unable to discuss the patient's medical information without the patient's explicit consent, and suggest they speak with the patient directly about their concerns. Explanation. This scenario presents a professional challenge because it requires the dental assistant to balance patient confidentiality with the need to provide accurate information to a concerned family member, all while adhering to the strict privacy regulations governing patient health information. The dental assistant must navigate the ethical obligation to protect patient privacy against the potential benefit of informing a caregiver about a condition that might impact the patient's well-being. The correct approach represents best professional practice because it prioritizes patient autonomy and legal compliance. By obtaining explicit consent from the patient before disclosing any information, the dental assistant upholds the principles of patient confidentiality and respects the patient's right to control their own health information, as mandated by relevant privacy laws. This ensures that all actions are legally sound and ethically defensible. An incorrect approach that involves disclosing information without patient consent violates fundamental privacy regulations. This action breaches patient confidentiality, potentially leading to legal repercussions and erosion of trust between the patient and the dental practice. It disregards the patient's right to privacy and autonomy over their personal health data. Another incorrect approach, that of providing vague or misleading information, is also professionally unacceptable. While it may seem like an attempt to be helpful without violating privacy, it can lead to misunderstandings, anxiety for the family member, and potentially delay necessary interventions if the family member is not fully informed of the situation. This approach fails to provide clear, actionable information and can be detrimental to the patient's overall care. The professional decision-making process in such situations should involve a clear understanding of privacy regulations, a commitment to patient autonomy, and open communication. When faced with a request for information from a family member, the professional should first ascertain if the patient is present and capable of consenting. If the patient is present, their consent should be directly sought. If the patient is not present or is unable to consent, the professional should politely explain that they are unable to share specific medical information due to privacy laws and suggest that the family member discuss their concerns directly with the patient. If there are immediate safety concerns that override privacy, consultation with the supervising dentist or a legal/ethical advisor would be the appropriate next step. Question 3. Risk assessment procedures indicate that a critical instrument was inadvertently exposed to a patient's bodily fluids and then placed in a holding solution without immediate cleaning. What is the most appropriate immediate action to mitigate the risk of cross-contamination? Option A. Proceed with the standard sterilization cycle for the instrument, assuming the holding solution has adequately disinfected it. Option B. Rinse the instrument under running water to remove gross debris before returning it to the holding solution until a full sterilization cycle can be completed. Option C. Immediately remove the instrument from the holding solution, thoroughly clean it according to manufacturer instructions, and then proceed with the appropriate sterilization cycle. Option D. Discard the instrument as single-use, even if it is a reusable instrument, to eliminate any potential risk. Correct answer is C. Immediately remove the instrument from the holding solution, thoroughly clean it according to manufacturer instructions, and then proceed with the appropriate sterilization cycle. Explanation. This scenario is professionally challenging because it requires the dental assistant to balance immediate patient care needs with stringent infection control protocols. The urgency of a procedure can sometimes create pressure to bypass or expedite steps, but adherence to established guidelines is paramount to prevent disease transmission. Careful judgment is required to identify potential breaches in protocol and to implement corrective actions without compromising patient safety or the integrity of the sterilization process. The correct approach represents best professional practice because it prioritizes patient and staff safety by directly addressing the identified risk through established, evidence-based infection control measures. This aligns with the fundamental ethical obligation of a dental professional to do no harm and with regulatory requirements that mandate specific protocols for instrument reprocessing. Following manufacturer instructions for sterilization equipment, and adhering to established guidelines for high-level disinfection or sterilization of critical and semi-critical instruments are non-negotiable. This proactive and thorough approach ensures that all instruments are rendered safe for subsequent use, minimizing the risk of cross-contamination. An incorrect approach that involves simply rinsing instruments under water before sterilization is professionally unacceptable. This action is insufficient to eliminate all microorganisms, particularly resilient spores, and fails to meet the standards for high-level disinfection or sterilization. Ethically, this constitutes a breach of the duty of care, as it knowingly exposes subsequent patients to potential pathogens. Regulatory failure lies in not adhering to the mandated sterilization processes, which are designed to prevent the transmission of infectious diseases. Another incorrect approach, using an unvalidated or outdated sterilization method, is also professionally unacceptable. Sterilization methods must be validated and maintained according to manufacturer specifications and regulatory standards to ensure efficacy. Relying on an unproven or compromised method introduces significant risk. This is an ethical failure because it disregards the established scientific basis for effective sterilization, and a regulatory failure because it violates guidelines that specify the use of approved and functioning sterilization equipment. A third incorrect approach, assuming that instruments are sterile because they were recently used, is a critical lapse in judgment and a direct violation of infection control principles. Sterility is not a permanent state. It is achieved through specific processes and can be compromised by improper handling, storage, or environmental factors. Ethically, this assumption endangers patients by creating a false sense of security regarding instrument safety. Regulatory failure occurs because it bypasses the essential steps of cleaning, disinfection, and sterilization that are legally mandated to ensure patient safety. The professional decision-making process for similar situations should involve a systematic risk assessment. This begins with identifying potential hazards, e.g., contaminated instruments, compromised sterilization cycle. Next, the likelihood and severity of harm associated with each hazard are evaluated. Based on this assessment, appropriate control measures are selected and implemented, prioritizing those that eliminate or reduce the risk to an acceptable level. This includes strict adherence to manufacturer instructions, regulatory guidelines, and established protocols for instrument reprocessing. Regular training, competency assessments, and a culture of safety that encourages reporting of potential issues are also crucial components of effective risk management in infection control. Question 4. System analysis indicates a patient is inquiring about the role of salivary glands in maintaining oral health. Which of the following best describes the primary functions and types of major salivary glands relevant to a dental assistant's scope of knowledge? Option A. Salivary glands, including the parotid, submandibular, and sublingual glands, are responsible for producing saliva which aids in lubrication, digestion, buffering, and maintaining oral hygiene. Option B. Salivary glands are primarily involved in taste perception and are responsible for producing enzymes that break down food particles. Option C. All saliva is produced by a single, large gland located in the cheek, and its main function is to keep the mouth moist. Option D. Salivary glands are mainly associated with the production of mucus for swallowing and are not directly involved in protecting tooth enamel. Correct answer is A. Salivary glands, including the parotid, submandibular, and sublingual glands, are responsible for producing saliva which aids in lubrication, digestion, buffering, and maintaining oral hygiene. Explanation. Scenario analysis. This scenario presents a common challenge in dental assisting, accurately identifying and explaining the function of salivary glands to a patient. The professional challenge lies in translating complex physiological information into understandable terms while maintaining patient comfort and trust. Misinformation can lead to patient anxiety, misunderstanding of oral health, and potentially noncompliance with treatment recommendations. Therefore, precise and accurate communication, grounded in the established understanding of salivary gland physiology, is paramount. Correct approach analysis. The correct approach involves accurately identifying the major salivary glands and their primary roles in saliva production and oral function. This demonstrates a strong understanding of dental anatomy and physiology, which is a core competency for a certified dental assistant. Providing accurate information about the parotid, submandibular, and sublingual glands, and their contributions to lubrication, digestion, and buffering aligns with the ethical obligation to educate patients and promote oral health. This approach upholds professional standards by ensuring the patient receives reliable information, fostering a collaborative patient-provider relationship. Incorrect approaches analysis. One incorrect approach would be to oversimplify the salivary gland function to the point of inaccuracy, such as stating that all saliva is produced by a single, unspecified gland. This fails to acknowledge the distinct roles and locations of the major salivary glands and misrepresents the complexity of oral physiology. Ethically, this is a failure to provide accurate patient education. Another incorrect approach would be to focus solely on the pathological aspects of salivary glands, such as discussing only salivary stones or infections, without first establishing the normal function. This can unnecessarily alarm the patient and deviates from the educational goal of explaining normal salivary gland function. It is professionally inappropriate as it introduces fear without context. A third incorrect approach would be to confuse the functions of salivary glands with other oral structures. For example, attributing taste sensation primarily to salivary glands rather than taste buds. This demonstrates a fundamental misunderstanding of oral anatomy and physiology, leading to misinformation. This is a direct failure in professional knowledge and patient education. Professional reasoning. Professionals should approach patient education by first recalling and verifying their knowledge of the relevant anatomical and physiological structures. When explaining complex topics, the process should involve breaking down information into digestible parts, using clear and accurate terminology, and tailoring the explanation to the patient's level of understanding. If unsure about specific details, consulting reliable resources or a supervising dentist is the appropriate course of action. The decision-making process should always prioritize patient well-being, accurate information dissemination, and adherence to professional standards of care. Question 5. The evaluation methodology shows that when assessing a patient's permanent dentition, a certified dental assistant must accurately identify tooth types and their eruption patterns. Which of the following approaches best reflects the required competency for this task? Option A. Focusing primarily on the patient's comfort during the examination and making a general assessment of tooth presence. Option B. Comparing the patient's current tooth eruption status to standard eruption charts and identifying teeth based on their characteristic morphology for each permanent tooth type. Option C. Estimating the number of permanent teeth present and assuming a typical eruption sequence based on the patient's general age. Option D. Relying on visual approximation of tooth shapes without consulting established eruption timelines or specific tooth characteristics. The correct answer is B. Comparing the patient's current tooth eruption status to standard eruption charts and identifying teeth based on their characteristic morphology for each permanent tooth type. Explanation. The evaluation methodology shows that a common challenge in assessing permanent dentition is accurately identifying and differentiating between various tooth types and their eruption sequences, especially when presented with atypical presentations or incomplete information. This requires a thorough understanding of established eruption patterns and the characteristic morphology of each permanent tooth. The correct approach represents best professional practice because it directly applies the established eruption timelines and characteristic features of permanent teeth as outlined by recognized dental authorities and educational standards for certified dental assistants. This ensures accurate charting, communication with the dentist, and appropriate patient education regarding oral development. Adherence to these standards is implicitly required by the CDA certification, which validates competency in fundamental dental knowledge. An incorrect approach that relies solely on visual approximation without considering established eruption sequences or characteristic tooth morphology is professionally unacceptable. This could lead to misidentification of teeth, inaccurate charting, and potentially flawed treatment planning by the dentist. Ethically, a CDA has a responsibility to provide accurate information and support to the dental team. Another incorrect approach that focuses only on the number of teeth present, without regard to their type or eruption stage, fails to meet the diagnostic requirements of assessing permanent dentition. Superficial assessment lacks the depth necessary for proper dental care and contravenes the expected level of knowledge for a certified professional. A further incorrect approach that prioritizes patient comfort over accurate assessment, while important in patient care, should not supersede the fundamental requirement of a correct clinical evaluation. The CDA's role includes both patient rapport and accurate clinical data collection. The professional decision-making process for similar situations involves a systematic approach. First, recall and apply the established eruption charts for permanent dentition, considering age ranges and typical sequences. Second, meticulously examine the morphology of each visible permanent tooth, comparing it to the characteristic features of incisors, canines, premolars, and molars. Third, correlate the observed teeth and their eruption status with the patient's age and developmental stage. Finally, accurately document findings according to established dental charting conventions, ensuring clear and precise communication with the supervising dentist. Question 6. The risk matrix shows a potential for parental anxiety regarding a child's tooth eruption. A parent expresses concern to the certified dental assistant, CDA, that their child's newly erupted tooth appears small and different from other teeth, questioning if it's a permanent tooth that erupted too early. The CDA has general knowledge of primary dentition characteristics. What is the most appropriate course of action for the CDA? Option A. State definitively that it is a primary tooth and will fall out, reassuring the parent that there is no need for further concern or discussion with the dentist. Option B. Offer to provide general educational materials about the typical characteristics and eruption sequence of primary teeth, explaining that differences in appearance are common, and suggest the parent discuss specific concerns with the dentist at the next scheduled appointment. Option C. Offer to take a closer look at the tooth to determine if it is a primary or permanent tooth, as the assistant can often identify such differences. Option D. Directly compare the child's tooth to a typical permanent tooth and explain that it is likely a primary tooth based on its size and shape, advising the parent not to worry. The correct answer is B. Offer to provide general educational materials about the typical characteristics and eruption sequence of primary teeth, explaining that differences in appearance are common, and suggest the parent discuss specific concerns with the dentist at the next scheduled appointment. Explanation. This scenario presents a professional challenge because the dental assistant must balance the immediate need to provide accurate information to a concerned parent with the ethical obligation to respect the dentist's treatment plan and scope of practice. Misinformation, even with good intentions, can undermine patient trust and lead to inappropriate actions. The core of the dilemma lies in distinguishing between providing general educational information about tooth development and offering specific diagnostic or treatment advice, which falls outside the dental assistant's purview. The correct approach represents best professional practice because it prioritizes patient education within the established scope of practice for a certified dental assistant, CDA, in the U.S. By offering to provide general information about primary dentition and its characteristics, the assistant is acting as an educator, empowering the parent with knowledge without overstepping professional boundaries. This aligns with ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as it prevents the dissemination of potentially inaccurate or premature advice. Furthermore, it respects the dentist-patient relationship by deferring specific diagnostic and treatment decisions to the dentist. This approach also adheres to the guidelines set forth by the Dental Assisting National Board, DANB, for CDAs, which emphasize the importance of patient education and the limitations of the assistant's role. An incorrect approach that involves directly comparing the child's teeth to a permanent tooth and suggesting a specific problem would be a regulatory and ethical failure. This constitutes practicing dentistry without a license, as it involves diagnosis and potentially recommending treatment, which are reserved for dentists. It violates the principle of non-maleficence by potentially causing undue alarm or leading the parent to make incorrect assumptions about the child's oral health. Ethically, it breaches the trust placed in the dental professional by providing information beyond their scope. Another incorrect approach, offering to look at it more closely to determine if it's a permanent tooth, also represents a significant ethical and regulatory failure. This implies a diagnostic capability that a CDA does not possess. It crosses the line from education to assessment, which is the dentist's responsibility. This could lead to misdiagnosis or a false sense of security, both of which are harmful to the patient and violate the principle of non-maleficence. It also undermines the dentist's authority and the established treatment plan. Finally, an incorrect approach that involves stating definitively that the tooth is just a baby tooth and will fall out without proper examination or understanding of the situation is also problematic. While it might be a primary tooth, making such a definitive statement without the dentist's assessment could be inaccurate and lead to the parent dismissing a potentially serious issue. This is a failure of accuracy and potentially non-maleficence, as it could result in delayed treatment if the tooth is indeed problematic. It also oversteps the assistant's role in providing definitive pronouncements about a patient's condition. The professional decision-making process for similar situations involves a clear understanding of one's scope of practice as defined by state dental practice acts and national certification bodies like DAMB. When faced with a patient or guardian's question that borders on diagnosis or treatment advice, the professional should 1. Acknowledge the concern. 2. Offer general, educational information within their scope. 3. Clearly state the limitations of their role and defer specific diagnostic or treatment questions to the dentist. 4. Document the interaction appropriately. This systematic approach ensures ethical conduct, regulatory compliance, and effective patient care. Question 7. Market research demonstrates that dental practices are increasingly seeking efficient and reliable methods for instrument reprocessing. A dental assistant is preparing to sterilize a set of surgical instruments that are heat-stable and will be used in invasive procedures. Considering the need for absolute assurance of microbial elimination, which sterilization method would be the most appropriate and compliant choice according to standard dental practice guidelines? Option A, high-level disinfection. Option B, chemical sterilant immersion. Option C, dry heat sterilization. Option D, autoclave. The correct answer is D, autoclave. Explanation: this scenario is professionally challenging because it requires a dental assistant to make a critical decision regarding instrument sterilization, directly impacting patient safety and regulatory compliance. The choice of sterilization method must align with established protocols and the specific needs of the instruments being processed. Failure to select the appropriate method can lead to ineffective sterilization, posing a significant risk of disease transmission. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the regulatory framework governing dental assisting. The Certified Dental Assistant (CDA) certification implies a commitment to upholding these standards. Selecting the autoclave method for heat-stable, critical instruments is the most effective and widely accepted method for achieving sterilization, as it utilizes steam under pressure to kill all microorganisms, including spores. This aligns with guidelines from organizations like the Centers for Disease Control and Prevention, CDC, and state dental boards, which mandate the sterilization of critical and semi-critical instruments. An incorrect approach that involves using chemical sterilants for instruments that are heat-stable and intended for critical use is professionally unacceptable. Chemical sterilants, while effective for some applications, may not achieve the same level of sterilization assurance as autoclaving for all types of instruments, and their use can be associated with potential toxicity and incomplete sterilization if not used precisely according to manufacturer instructions and regulatory guidelines. Furthermore, relying solely on chemical sterilization for instruments that can withstand autoclaving overlooks the superior efficacy and reliability of the latter for critical items. Another incorrect approach, using dry heat sterilization for instruments that are not compatible with high temperatures or prolonged exposure to dry heat, is also professionally unacceptable. Dry heat sterilization requires higher temperatures and longer exposure times than autoclaving, which can damage certain materials, compromise instrument integrity, and potentially lead to incomplete sterilization. This demonstrates a lack of understanding of the specific requirements of different sterilization methods and their suitability for various instrument types. Finally, an incorrect approach that involves relying on disinfection rather than sterilization for critical instruments is a severe ethical and regulatory failure. Disinfection reduces the number of microorganisms, but does not eliminate them, making it insufficient for instruments that penetrate sterile tissues or contact mucous membranes. This directly violates the fundamental principle of infection control and poses an unacceptable risk to patients. The professional decision-making process for similar situations should involve a systematic evaluation of the instrument's classification: critical, semi-critical, non-critical, their material composition, and the recommended sterilization methods outlined in manufacturer instructions and regulatory guidelines. A dental assistant should always consult their clinic's infection control manual and relevant professional standards to ensure the highest level of patient safety and compliance. Question 8. The control framework reveals that a dental assistant is preparing to see a new patient for a routine cleaning. The assistant has just finished with a previous patient who had no visible bleeding. The assistant considers whether to change gloves and put on a new mask before seeing the next patient. Which of the following actions best demonstrates adherence to standard precautions in a U.S. dental setting? Option A. Proceed with the cleaning using the same gloves and mask, as there was no visible bleeding from the previous patient. Option B. Change gloves but reuse the same mask as it appears clean. Option C. Put on a new mask but reuse the same gloves as they were not visibly soiled. Option D. Change gloves and put on a new mask before seeing the next patient. Correct answer is D. Change gloves and put on a new mask before seeing the next patient. Explanation. This scenario presents a common challenge in dental settings, ensuring consistent and effective application of standard precautions when faced with varying levels of perceived risk and potential for distraction. The professional challenge lies in maintaining vigilance and adherence to established protocols, even when routine tasks might lead to complacency or when external factors, like patient anxiety or time pressures, can influence behavior. Careful judgment is required to prioritize patient and staff safety above all else, recognizing that even seemingly minor breaches can have significant consequences. The correct approach represents best professional practice because it demonstrates a proactive and comprehensive understanding of standard precautions as mandated by regulatory bodies such as the Occupational Safety and Health Administration (OSHA) in the United States, which governs dental assisting practice. This approach prioritizes the use of appropriate personal protective equipment, PPE, gloves, masks, eye protection, and gowns for all patient encounters, regardless of the perceived risk of blood or body fluid exposure. It also emphasizes proper hand hygiene before and after patient contact, and the safe handling and disposal of contaminated instruments and waste. This aligns with the ethical obligation to provide a safe environment for both patients and the dental team, minimizing the transmission of infectious agents. An incorrect approach that involves skipping glove changes between patients, even if the patient is not visibly bleeding, represents a significant regulatory and ethical failure. This violates the principle of treating all bodily fluids as potentially infectious, a cornerstone of standard precautions. It increases the risk of cross-contamination between patients, potentially transmitting pathogens. Another incorrect approach, such as reusing disposable masks or not properly cleaning and disinfecting operatory surfaces between patients, also constitutes a failure to adhere to established infection control guidelines. These actions directly compromise the safety of the environment and increase the likelihood of disease transmission, violating both regulatory requirements and ethical duties of care. The professional decision-making process for similar situations should involve a constant self-assessment and adherence to established protocols. This includes 1. Recognizing that standard precautions apply to all patients, irrespective of their known infection status. 2. Proactively selecting and using appropriate PPE for each procedure. 3. Performing meticulous hand hygiene at critical junctures. 4. Following strict protocols for instrument cleaning, disinfection, and sterilization, as well as waste management. 5. Remaining aware of the potential for exposure and acting to mitigate risks, even in routine situations. This systematic approach ensures compliance with regulations and upholds the highest ethical standards of patient care and workplace safety. Question 9. Quality control measures reveal that a dental assistant has charted a specific anatomical feature of the oral cavity. The assistant's documentation is being reviewed for accuracy and adherence to professional standards. The feature in question is a small, raised papilla located at the base of the tongue, which is known to be involved in the gag reflex. The assistant's chart entry for this feature is gag reflex bump. Which of the following represents the most accurate and professionally appropriate documentation of this oral cavity structure? Option A, circumvallate papilla. Option B, median lingual sulcus. Option C, lingual tonsil. Option D, uvula. Correct answer is C, lingual tonsil. Explanation. Scenario analysis. This scenario presents a challenge in accurately identifying and documenting oral cavity structures, which is fundamental to providing appropriate dental care. Misidentification can lead to incorrect treatment planning, inadequate charting, and potential patient harm. The professional challenge lies in ensuring the dental assistant possesses and applies the necessary knowledge and skills for precise anatomical recognition and documentation within the scope of their practice, as defined by the Certified Dental Assistant (CDA) certification standards. Correct approach analysis. The correct approach involves the dental assistant accurately identifying the specific oral cavity structure based on its anatomical characteristics and location, and then documenting it using precise terminology as per established dental charting conventions. This aligns with the CDA's responsibility to assist in patient care through accurate observation and recording, adhering to professional standards of practice, and the ethical obligation to maintain accurate patient records. This ensures continuity of care and effective communication among the dental team. Incorrect approaches analysis. One incorrect approach involves the dental assistant making a generalized assumption about the structure's identity without precise identification. This fails to meet the standard of accuracy required in dental charting and can lead to miscommunication and improper treatment. It violates the ethical principle of competence and the regulatory expectation for accurate record keeping. Another incorrect approach is to document the structure based on its perceived function rather than its anatomical identification. While function is important, accurate charting requires precise anatomical nomenclature. This approach demonstrates a lack of understanding of proper dental terminology and charting protocols, potentially leading to confusion and errors in diagnosis or treatment. A further incorrect approach is to omit the documentation of the structure altogether due to uncertainty. While it is better than incorrect documentation, it still represents a failure to fulfill the charting requirements and can leave gaps in the patient's record, hindering comprehensive care and potentially violating record-keeping regulations. Professional reasoning. Professionals should approach this situation by first recalling their training and the specific anatomical landmarks of the oral cavity. If there is any doubt, they should consult their supervising dentist or a reliable anatomical reference. The decision-making process involves 1. Observation. Carefully examine the structure in question. 2. Identification. Apply knowledge of oral anatomy to determine the precise name of the structure. 3. Documentation. Record the identified structure using standardized dental terminology. 4. Verification. If unsure, seek clarification from a qualified supervisor before finalizing the record. This systematic approach ensures accuracy, patient safety, and adherence to professional standards. Question 10. Operational review demonstrates a patient presenting with a palpable, tender swelling in the submandibular area of their neck. Based on the standard lymphatic drainage pathways of the head and neck, which lymph nodes should be the primary focus of palpation to assess for potential involvement related to this swelling? Option A. Submandibular lymph nodes. Option B. Supraclavicular lymph nodes. Option C. Axillary lymph nodes. Option D. Preauricular lymph nodes. The correct answer is A. Submandibular lymph nodes. Explanation. Scenario analysis. This scenario presents a professional challenge in a dental assisting context where a patient presents with a palpable swelling in the submandibular region. Accurately identifying the lymphatic drainage pathway and the involved lymph nodes is crucial for effective patient care and communication with the supervising dentist. Misidentification can lead to incorrect assumptions about the source of infection or inflammation, potentially delaying appropriate diagnosis and treatment. The challenge lies in applying theoretical knowledge of head and neck lymphatic anatomy to a real-world clinical presentation, requiring precise anatomical recall and understanding of drainage patterns. Correct approach analysis. The correct approach involves recognizing that swelling in the submandibular region is most commonly associated with the drainage of structures in the floor of the mouth, tongue, and mandibular teeth. Therefore, palpating the submandibular lymph nodes is the most direct and diagnostically relevant action. This aligns with best professional practice as it directly addresses the clinical finding by assessing the most likely anatomical structures involved in lymphatic drainage from the suspected affected areas. This approach is ethically sound as it prioritizes patient assessment based on anatomical knowledge and clinical presentation. Incorrect approach is analysis. Palpating the preauricular lymph nodes is incorrect because these nodes primarily drain the external ear, eyelids, and temporal region. While a dental infection could theoretically spread, it is not the primary or most direct drainage pathway for structures commonly associated with submandibular swelling. This approach demonstrates a failure to apply accurate anatomical knowledge to the clinical situation, potentially leading to a misdiagnosis or delayed diagnosis. Palpating the supraclavicular lymph nodes is incorrect, as these nodes drain the chest and abdomen. They are anatomically distant from the head and neck structures, typically involved in dental infections that would present with submandibular swelling. This approach shows a significant lack of understanding of regional lymphatic anatomy and would be a gross misapplication of diagnostic assessment. Palpating the axillary lymph nodes is incorrect because these nodes drain the upper extremities and chest wall. They are entirely unrelated to the lymphatic drainage of the head and neck, and would be an irrelevant and unprofessional assessment in this context. This approach indicates a fundamental misunderstanding of anatomical relationships and lymphatic pathways. Professional reasoning. When faced with a palpable swelling in the head and neck, a dental assistant should first consider the most common anatomical structures and their lymphatic drainage patterns. The location of the swelling is the primary clue. The professional reasoning process involves 1. Identifying the anatomical region of the swelling. 2. Recalling the relevant lymphatic drainage pathways for structures within that region. 3. Determining which lymph nodes are most likely to be involved based on the drainage patterns. 4. Performing a targeted physical assessment of those specific lymph nodes. This systematic approach ensures that the assessment is clinically relevant, anatomically accurate, and supports the dentist's diagnostic process. Question 11. Assessment of a dental assistant's proficiency in documenting a patient's dental status requires evaluating their ability to accurately record findings using a recognized tooth identification system. Which of the following methods best demonstrates adherence to professional standards for tooth identification and charting? Option A. Consistently using the universal numbering system for all permanent and primary teeth, ensuring clear and unambiguous notation for each tooth's location and condition. Option B. Employing a personal shorthand system developed by the assistant which is understood only by the assistant and the supervising dentist. Option C. Relying on descriptive terms for tooth location, e.g., upper right back tooth, rather than a standardized numerical or symbolic system. Option D. Mixing elements of the universal numbering system and Palmer notation interchangeably within the same patient chart, without explicit indication. The correct answer is A. Consistently using the universal numbering system for all permanent and primary teeth, ensuring clear and unambiguous notation for each tooth's location and condition. Explanation. This scenario is professionally challenging because accurate tooth identification is foundational to effective dental care, treatment planning, and communication among dental professionals. Misidentification can lead to incorrect charting, inappropriate treatment, and potential patient harm, necessitating a robust understanding of standardized systems. The correct approach represents best professional practice because it demonstrates a commitment to standardized, universally understood communication within the dental field. Utilizing the Universal Numbering System, Palmer notation, or FDI World Dental Federation notation, consistently and accurately ensures that all members of the dental team, including the dentist, hygienist, and other assistants, can interpret patient records without ambiguity. This adherence to established systems is implicitly required by the general duty of care and professional conduct expected of a certified dental assistant, ensuring patient safety and efficient practice operations. An incorrect approach that relies solely on informal or personal shorthand for tooth identification is professionally unacceptable. This failure constitutes a breach of professional standards by introducing ambiguity and the potential for miscommunication, which directly impacts patient safety and the quality of care. Such a practice could be considered negligent, as it deviates from established protocols designed to prevent errors. Another incorrect approach, using a system inconsistently or mixing elements from different systems without clear indication, also creates confusion and increases the risk of misinterpretation, violating the principle of clear and accurate record keeping. Professional reasoning in such situations involves prioritizing patient safety and clear communication. When faced with a task involving tooth identification, a dental assistant should always default to the established, recognized systems, Universal, Palmer, or FDI, as dictated by the practice's protocols or the specific context of the patient's record. If there is any doubt about the correct system or its application, the assistant should seek clarification from the supervising dentist or a senior team member before proceeding. This proactive approach ensures accuracy and upholds professional integrity. Question 12. Comparative studies suggest that a patient reports sharp, localized pain when touching the anterior two-thirds of their tongue and also experiences difficulty with the initial chewing motion of their jaw. Which of the following best describes the primary neural pathways involved in these distinct symptoms, as understood within the scope of a certified dental assistant's knowledge? Option A. The anterior two-thirds of the tongue sensory innervation is primarily from the chorda tympani nerve, while the motor component of initial jaw chewing is controlled by the muscles innervated by the accessory nerve. Option B. The anterior two-thirds of the tongue sensory innervation is primarily from the facial nerve, while the motor component of initial jaw chewing is controlled by the muscles innervated by the trigeminal nerve. Option C. The anterior two-thirds of the tongue's sensory innervation is primarily from the glossopharyngeal nerve, while the motor component of initial jaw chewing is controlled by the muscles innervated by the hypoglossal nerve. Option D. The anterior two-thirds of the tongue's sensory innervation is primarily from the lingual nerve, a branch of the mandibular nerve, while the motor component of initial jaw chewing is controlled by the muscles innervated by the masseteric nerve, also a branch of the mandibular nerve. The correct answer is D. The anterior two-thirds of the tongue's sensory innervation is primarily from the lingual nerve, a branch of the mandibular nerve, while the motor component of initial jaw chewing is controlled by the muscles innervated by the masseteric nerve, also a branch of the mandibular nerve. Explanation: this scenario is professionally challenging because it requires a dental assistant to accurately identify the source of patient-reported symptoms related to oral nerve innervation, which directly impacts the safety and efficacy of dental procedures. Misidentification can lead to inappropriate treatment, patient discomfort, or even iatrogenic injury. Careful judgment is required to differentiate between sensory and motor nerve involvement, and to understand the specific nerves responsible for different areas of the oral cavity. The correct approach represents best professional practice because it demonstrates a thorough understanding of oral anatomy and neuroanatomy, specifically the sensory and motor innervation of the oral cavity, as outlined by the Certified Dental Assistant (CDA) regulatory framework. This understanding allows for accurate assessment of patient complaints and effective communication with the supervising dentist. Adhering to this knowledge base ensures that patient care is based on sound scientific principles and regulatory expectations for dental assistants. An incorrect approach that focuses solely on superficial symptoms without considering the underlying neural pathways fails to meet the professional standards expected of a CDA. This could lead to misdiagnosis and inappropriate intervention, potentially violating patient safety regulations and ethical guidelines that mandate competent patient assessment. Another incorrect approach that attributes all oral sensations to a single, generalized nerve pathway ignores the complex and specific innervation of different oral structures. This demonstrates a lack of detailed knowledge, which is a regulatory failure, as CDAs are expected to possess a comprehensive understanding of oral anatomy and physiology. Such an approach could result in overlooking critical diagnostic information. A further incorrect approach that suggests motor nerve involvement for purely sensory complaints is a significant diagnostic error. This misunderstands the fundamental distinction between sensory and motor function, leading to potentially harmful treatment decisions and a failure to uphold the professional responsibility to accurately assess patient conditions. The professional decision-making process for similar situations should involve a systematic approach. 1. Listen carefully to the patient's description of the symptoms, noting location, quality, and duration. 2. Relate the reported symptoms to the known anatomical structures and their corresponding nerve innervations within the oral cavity. 3. Differentiate between sensory pain, temperature, touch, taste, and motor muscle movement functions. 4. Consider the specific cranial nerves and their branches responsible for innervating the affected areas, e.g., trigeminal nerve for sensation, facial nerve for motor function of facial muscles involved in oral functions. 5. Formulate a differential assessment based on this anatomical and neurological understanding. 6. Communicate findings clearly and concisely to the supervising dentist, providing specific anatomical and neurological context for the patient's symptoms. Question 13. The performance metrics show a slight increase in reported instances of improper hand hygiene among clinical support staff during routine observations. During a recent patient appointment, you observe a dental assistant briefly touching their gloved hand to their face before proceeding to adjust a patient's bib. This action, while not directly contaminating a sterile instrument, deviates from the strict protocol of avoiding any hand-to-face contact while gloved and before changing gloves. What is the most appropriate immediate course of action? Option A. Immediately after the patient appointment concludes, approach the dental assistant privately to discuss the observed behavior, reiterate the importance of hand hygiene protocols, and demonstrate the correct technique. Option B. Make a mental note of the incident and address it during the next scheduled staff meeting when discussing general infection control best practices. Option C. Document the incident and submit a formal report to the dental board without speaking to the dental assistant first. Option D. Publicly address the dental assistant in the presence of other team members to ensure everyone understands the seriousness of hand hygiene. The correct answer is A. Immediately after the patient appointment concludes, approach the dental assistant privately to discuss the observed behavior, reiterate the importance of hand hygiene protocols, and demonstrate the correct technique. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct observation of a deviation from a critical infection control protocol. The dental assistant's actions, while seemingly minor, have significant implications for patient safety and the integrity of the dental practice's infection control program. The challenge lies in addressing the observed behavior promptly and effectively without causing undue distress or creating a defensive reaction, while ensuring adherence to established standards. Correct approach analysis. The correct approach, which involves a private, direct conversation with the observed dental assistant, represents best professional practice. This aligns with the principles of maintaining a safe patient environment and upholding professional conduct, as mandated by regulatory bodies overseeing dental assisting. Specifically, it addresses the immediate risk of potential cross-contamination, which is a core concern in infection control guidelines. This direct, private feedback allows for immediate correction, education, and reinforcement of proper hand hygiene techniques, minimizing the risk of future lapses. It respects the individual while prioritizing patient well-being and compliance with established protocols. Incorrect approaches analysis. One incorrect approach involves ignoring the observed lapse in hand hygiene. This is a significant regulatory and ethical failure. It directly contravenes the fundamental principles of infection control, which are paramount in dental practice to prevent the transmission of pathogens. By not addressing the issue, the supervisor implicitly condones the behavior, increasing the risk of patient harm and potentially violating practice standards or guidelines that mandate adherence to infection control protocols. This inaction can also undermine the credibility of the practice's commitment to safety. Another incorrect approach is to publicly reprimand the dental assistant in front of colleagues. This is professionally unacceptable due to its disrespectful and potentially humiliating nature. While addressing the issue is necessary, public criticism can lead to defensiveness, damage professional relationships, and create a negative work environment. Ethically, it violates principles of respect and dignity. From a regulatory standpoint, while infection control is critical, the method of correction must also align with professional conduct standards, which generally advocate for private and constructive feedback. A third incorrect approach is to report the incident to a higher authority without first attempting to address it directly with the individual. While reporting serious breaches may be necessary in some contexts, bypassing direct communication for a first-time observed lapse in hand hygiene is often an overreaction. It fails to provide the individual with an immediate opportunity for correction and learning, and it can be perceived as punitive rather than educational. This approach may not align with a practice's internal disciplinary or corrective action policies, which typically encourage supervisors to manage minor issues directly. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and ethical conduct. When observing a lapse in a critical protocol like hand hygiene, the immediate steps should be: 1. Assess the immediate risk to patients. 2. Address the issue directly and privately with the individual involved, providing clear, constructive feedback and reinforcing the correct procedure. 3. Document the observation and the corrective action taken, if appropriate according to practice policy. 4. If the behavior persists or is part of a pattern, then escalate to more formal disciplinary or educational measures, potentially involving higher authorities or formal training. This approach balances the need for immediate correction with professional respect and a focus on education and improvement. Question 14. To address the challenge of a torn glove during a routine dental procedure, which of the following actions best upholds infection control standards and patient safety? Option A. Continue the procedure but be extra careful to avoid touching anything with the torn glove. Option B. Remove the torn glove and continue the procedure without replacing it as the procedure is almost complete. Option C. Immediately stop the procedure. Inform the patient. Remove the torn glove and replace it with a new one before continuing. Option D. Ignore the torn glove and continue the procedure as if nothing happened to avoid disrupting the patient. The correct answer is C. Immediately stop the procedure, inform the patient, remove the torn glove, and replace it with a new one before continuing. Explanation. Scenario analysis. This scenario presents a common challenge in dental assisting, maintaining optimal infection control while dealing with a sudden, unexpected breach in personal protective equipment, PPE. Professional challenge lies in the immediate need to prevent cross-contamination and protect both the patient and the dental assistant, without causing undue alarm or disruption to the procedure. This requires quick, informed decision-making based on established protocols. Correct approach analysis. The correct approach prioritizes patient safety and infection control by immediately ceasing the procedure, informing the patient, and replacing the contaminated PPE. This aligns directly with the Centers for Disease Control and Prevention, CDC guidelines for infection control in dental settings, which are foundational for the Certified Dental Assistant, CDA certification. The CDC emphasizes the importance of a functional barrier, PPE, to prevent the transmission of infectious agents. Replacing the torn glove before continuing demonstrates adherence to standard precautions and the principle of maintaining aseptic technique. Incorrect approaches analysis. Continuing the procedure with a torn glove represents a significant failure to adhere to standard precautions and infection control protocols. This action directly violates the principle of maintaining a barrier against potential pathogens, increasing the risk of cross-contamination to the patient and the dental assistant. It demonstrates a lack of professional judgment and disregard for established safety guidelines, which could have serious ethical and legal ramifications. Removing the torn glove, but not immediately replacing it before continuing the procedure, is also a critical failure. While the intention might be to minimize disruption, it leaves the assistant's hand exposed to potential contaminants, compromising aseptic technique. This still poses a risk of cross-contamination and is not in line with best practices for infection control. Ignoring the torn glove and continuing the procedure without any intervention is the most egregious failure. This demonstrates a complete disregard for patient safety, infection control principles, and professional responsibility. It exposes both the patient and the assistant to unnecessary risks of infection and is a clear violation of ethical and regulatory standards for dental healthcare professionals. Professional reasoning. Professionals should approach such situations by first recognizing the breach in their protective barrier. The immediate priority is to halt the procedure to prevent further contamination. Next, clear and concise communication with the patient is essential to inform them of the situation and reassure them that appropriate steps are being taken. The core of the decision-making process involves understanding the hierarchy of infection control measures, where maintaining intact PPE is a fundamental step. When this barrier is compromised, the immediate and correct response is to restore it before resuming any patient care activities. This systematic approach ensures patient safety, upholds professional integrity, and adheres to regulatory requirements. Question 15. Process analysis reveals that a patient undergoing treatment for temporomandibular joint, TMJ, dysfunction is asking the dental assistant for a more detailed explanation of how their jaw joint works and why they are experiencing pain. Which of the following approaches best aligns with the certified dental assistant's role and responsibilities in patient education regarding TMJ anatomy and function? Option A. Describing the TMJ as a complex joint that is difficult to explain and advising the patient to research TMJ disorders online for more information. Option B. Offering a detailed anatomical diagram of the TMJ and explaining the potential causes of TMJ disorders, including malocclusion and bruxism, as discussed in advanced dental textbooks. Option C. providing a clear, concise explanation of the TMJ's basic anatomy, condyle, fossa, disc, and its typical function in opening, closing, and lateral jaw movements, reinforcing information previously shared by the dentist. Option D. Reassuring the patient that the dentist will address all their concerns during the next appointment, and that the assistant is not qualified to discuss TMJ anatomy or function. The correct answer is C. Providing a clear, concise explanation of the TMJ's basic anatomy, condyle, fossa, disc, and its typical function in opening, closing, and lateral jaw movements, reinforcing information previously shared by the dentist. Explanation. This scenario is professionally challenging because a dental assistant must accurately interpret and communicate information about TMJ anatomy and function to a patient, ensuring the patient understands their condition and treatment plan without overstepping the scope of practice. The assistant must rely on established dental principles and patient education guidelines. The correct approach represents best professional practice because it aligns with the Certified Dental Assistant (CDA) role in patient education, which is to reinforce information provided by the dentist and ensure patient comprehension. This approach adheres to ethical guidelines by providing accurate, understandable information within the assistant's scope of practice, promoting patient autonomy and informed consent. It also implicitly supports the dentist's treatment plan by facilitating patient understanding. An incorrect approach that focuses on diagnosing the TMJ condition or suggesting specific treatment modalities would be a regulatory and ethical failure. Diagnosing is the exclusive purview of the licensed dentist. Suggesting specific treatments without the dentist's direction constitutes practicing dentistry without a license and violates professional boundaries. Another incorrect approach, such as dismissing the patient's concerns or providing overly simplistic, inaccurate information, would be an ethical failure in patient care and communication, potentially leading to patient dissatisfaction, non-compliance with treatment, and a breach of trust. Professional decision-making in such situations requires a clear understanding of the dental assistant's scope of practice, adherence to the dentist's instructions, and a commitment to providing accurate, patient-centered education. The assistant should always defer diagnostic and treatment planning questions to the dentist and focus on reinforcing the information already provided, ensuring the patient feels heard and understood. Question 16. Compliance review shows a new dental assistant is charting a patient's dentition and is asked to describe the typical anatomical features of a mandibular first molar. Which of the following descriptions most accurately reflects standard dental anatomy for this tooth? Option A. Usually possesses 3 roots, with 1 prominent buccal root and 2 smaller lingual roots. Option B. Commonly exhibits 2 roots, with a broad buccal root and a narrower lingual root and a distinct furcation. Option C. Typically has 2 roots, with a prominent mesial root that is often bifurcated and a smaller distal root. Option D. Generally has a single, conical root with no significant furcation. Correct answer is C. Typically has 2 roots, with a prominent mesial root that is often bifurcated and a smaller distal root. Explanation. This scenario is professionally challenging because accurately identifying and describing dental anatomy is fundamental to providing safe and effective patient care. Misidentification can lead to incorrect treatment planning, improper instrumentation, and potential harm to the patient. Careful judgment is required to ensure precise anatomical knowledge is applied in all clinical situations. The correct approach represents best professional practice because it demonstrates a thorough understanding of dental anatomy, specifically the variations in tooth morphology and eruption patterns. This knowledge is crucial for accurate charting, diagnosis, and treatment, directly aligning with the CDA's responsibility to assist the dentist in providing quality care. Adherence to established anatomical terminology ensures clear communication among the dental team and with the patient, minimizing errors and promoting patient safety, which is a core ethical and regulatory expectation for dental assistants. An incorrect approach that relies on generalized descriptions or assumptions about tooth anatomy is professionally unacceptable. This failure to recognize specific anatomical features, such as the number of cusps on a molar or the root structure of a premolar, can lead to diagnostic errors and inappropriate treatment. Ethically, it breaches the duty of care owed to the patient. Regulationally, it may violate standards of practice that require dental assistants to possess and apply accurate anatomical knowledge. Another incorrect approach that focuses solely on the visible crown without considering the root anatomy is also problematic. The root structure is critical for procedures like endodontics or extractions. Neglecting this aspect demonstrates incomplete anatomical understanding and can lead to complications during treatment. This failure to consider the full scope of tooth anatomy is a direct contravention of the professional standards expected of a CDA. The professional reasoning process for similar situations should involve a systematic approach to anatomical identification. This includes reviewing patient records, utilizing diagnostic aids like radiographs, and consulting with the supervising dentist when in doubt. A commitment to continuous learning and staying updated on anatomical variations is essential. Professionals should always prioritize accuracy and patient safety, ensuring their actions are grounded in a solid understanding of dental anatomy and physiology, as mandated by the CDA certification standards. Question 17. Governance review demonstrates that a patient presents for a routine appointment with visibly red and slightly swollen gingiva that bleeds when the patient brushes their teeth. As a certified dental assistant, CDA, in the U.S., what is the most appropriate immediate action to take to optimize the patient's oral health outcome and ensure regulatory compliance? Option A. Perform a thorough gingival assessment, document all findings objectively, and present them to the supervising dentist for diagnosis and treatment planning. Option B. Advise the patient that the symptoms are likely minor and can be managed with over-the-counter mouthwash, and proceed with the scheduled appointment without further comment. Option C. Document the condition as gingivitis in the patient's chart and begin scaling and root planing as per standard protocol. Option D. Immediately instruct the patient on advanced oral hygiene techniques for gingivitis and schedule a follow-up appointment for re-evaluation in 1 month. The correct answer is A. Perform a thorough gingival assessment, document all findings objectively, and present them to the supervising dentist for diagnosis and treatment planning. Explanation. Scenario analysis. This scenario presents a common challenge in dental assisting where a patient exhibits signs of gingival inflammation. The challenge lies in accurately assessing the severity of the condition and determining the appropriate course of action within the scope of practice for a certified dental assistant, CDA. In the U.S., misinterpretation can lead to delayed or inappropriate treatment, potentially worsening the patient's oral health and violating professional standards. The CDA must balance patient care with adherence to regulatory guidelines and the dentist's treatment plan. Correct approach analysis. The correct approach involves the CDA performing a thorough visual and tactile examination of the gingiva, noting signs of inflammation such as redness, swelling, bleeding on probing, and any evidence of calculus. This assessment is then communicated clearly and concisely to the supervising dentist, along with objective findings. This aligns with the CDA's role as an integral part of the dental team, supporting the dentist in diagnosis and treatment planning. The CDA's responsibility is to gather and present information accurately, allowing the dentist to make the definitive diagnosis and prescribe treatment. This adheres to the principles of patient safety and professional responsibility as outlined by the Dental Assisting National Board, DANB, and State Dental Practice Acts, which define the scope of practice for CDAs. Incorrect approaches analysis. Initiating treatment for gingivitis without a dentist's diagnosis and specific instructions is a significant regulatory and ethical failure. This oversteps the CDA's scope of practice, which typically does not include independent diagnosis or treatment planning. It violates the principle of practicing under the direct or indirect supervision of a licensed dentist as mandated by state dental practice acts. Furthermore, assuming the condition is mild and only recommending home care without professional evaluation could delay necessary intervention, potentially leading to the progression of periodontal disease, which is a breach of the duty of care owed to the patient. Another incorrect approach is to dismiss the patient's symptoms as normal or insignificant. This demonstrates a lack of diligence and a failure to recognize potential signs of disease. Ethically, all patient complaints and observable signs should be taken seriously. From a regulatory standpoint, failing to report potential oral health issues to the dentist could be seen as negligence and a violation of the standard of care expected from a dental professional. Finally, documenting the condition as gingivitis without a formal diagnosis from the dentist is also problematic. While the CDA may suspect gingivitis based on their training, the official diagnosis and treatment plan must come from the licensed dentist. This ensures accurate record-keeping and legal compliance, as diagnostic responsibilities are reserved for dentists. Professional reasoning. Professionals should approach such situations by first recognizing their role and limitations within the regulatory framework. A systematic assessment, focusing on objective observation and data collection, is crucial. This data should then be presented to the supervising dentist in a clear, factual manner. The decision-making process should always prioritize patient safety and adherence to the established scope of practice. When in doubt, seeking clarification from the supervising dentist is paramount. This iterative process of assessment, communication, and collaboration ensures that patient care is delivered ethically and in compliance with all applicable laws and guidelines. Question 18. Consider a scenario where a dental assistant is examining a patient's posterior tooth and observes a tooth with a broad chewing surface and multiple cusps, which appears to be a molar. However, the assistant notes that this particular molar has a slightly more pronounced lingual cusp than typically seen in standard anatomical diagrams. What is the most appropriate action for the dental assistant in this situation? Option A. Note the tooth as a molar but focus the documentation on the patient's overall oral hygiene rather than specific anatomical features. Option B. Accurately document the tooth as a molar and describe its specific anatomical variation, including the pronounced lingual cusp, for the dentist's review. Option C. Identify the tooth as a premolar due to the unusual cusp prominence. Option D. Assume the variation is insignificant and document it simply as a molar without further detail. The correct answer is B. Accurately document the tooth as a molar and describe its specific anatomical variation, including the pronounced lingual cusp, for the dentist's review. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the dental assistant to identify a potential anomaly in a patient's molar structure that could impact treatment planning and patient prognosis. The risk lies in misinterpreting the variation, leading to inappropriate advice or documentation, which could compromise patient care and violate professional standards. Accurate identification and understanding of molar variations are crucial for effective dental assisting. Correct approach analysis. The correct approach involves recognizing the characteristic features of a molar, specifically its cusps and occlusal surface, and identifying that the observed variation deviates from typical anatomy. This demonstrates a foundational understanding of dental morphology, which is a core competency for a certified dental assistant. By correctly identifying the tooth as a molar and noting its variation, the assistant is positioned to accurately communicate this observation to the supervising dentist, facilitating appropriate diagnostic and treatment decisions. This aligns with the ethical obligation to provide accurate information and support the dentist's role in patient care. Incorrect approaches analysis. One incorrect approach involves misidentifying the tooth type altogether. If the assistant mistakes a molar for a premolar or incisor, they are failing to apply basic knowledge of dental anatomy. This error could lead to incorrect charting, communication with the dentist, and potentially influence treatment decisions based on a false premise, violating the standard of care and professional responsibility. Another incorrect approach is to observe a variation but fail to recognize it as such, perhaps by assuming all molar anatomy is uniform. This lack of critical observation and anatomical knowledge means a potential issue is overlooked. This can lead to incomplete patient records and missed opportunities for early detection of developmental anomalies or pathological conditions, which is a failure in the duty of care. A third incorrect approach is to identify it as a molar but describe its characteristics inaccurately, for example, by miscounting cusps or misinterpreting the occlusal pattern. This demonstrates a superficial understanding of molar morphology and can lead to confusion and miscommunication with the dental team, undermining the assistant's role in supporting efficient and accurate patient management. Professional reasoning. Professionals should approach such situations by first applying their foundational knowledge of dental anatomy to identify the tooth type. Then, they should carefully observe and document the specific characteristics of that tooth, paying close attention to any deviations from typical morphology. This systematic approach, coupled with clear and accurate communication with the supervising dentist, ensures that patient care is based on precise information and supports effective treatment planning. Question 19. The investigation demonstrates a dental assistant encountering various waste materials after a patient procedure. These materials include used disposable needles, gauze with blood, and uncontaminated paper towels. The assistant must determine the correct disposal method for each type of waste according to the Certified Dental Assistant (CDA) regulatory framework. Which of the following actions best represents adherence to best practices for medical waste management in this scenario? Option A. Place used needles and blood-soaked gauze in a biohazardous waste bag and discard uncontaminated paper towels in the same bag. Option B. Place all used needles in a puncture-resistant sharps container, blood-soaked gauze in a biohazardous waste bag, and uncontaminated paper towels in a general waste bin. Option C. Dispose of all waste materials, including needles and blood-soaked gauze, in the general waste bin to simplify the process. Option D. Place used needles in a puncture-resistant sharps container and dispose of all other waste, including blood-soaked gauze and paper towels, in the general waste bin. The correct answer is B. Place all used needles in a puncture-resistant sharps container, blood-soaked gauze in a biohazardous waste bag, and uncontaminated paper towels in a general waste bin. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a dental assistant to accurately identify and manage different categories of medical waste, each with specific disposal protocols. Failure to do so can lead to significant health risks, environmental contamination, and legal penalties. The assistant must exercise careful judgment to ensure compliance with the relevant regulatory framework for medical waste management. Correct approach analysis. The correct approach involves segregating waste into appropriate categories, e.g., sharps, biohazardous, general, and following the established disposal procedures for each. This aligns with best professional practice by prioritizing infection control, patient safety, and environmental protection. Adherence to these protocols is mandated by regulatory bodies to prevent the spread of disease and ensure responsible waste handling. Incorrect approaches analysis. One incorrect approach involves disposing of all waste in a single general waste bin. This is a significant regulatory and ethical failure because it bypasses essential segregation protocols for biohazardous and sharps waste. It increases the risk of needle-stick injuries for waste handlers and the public, and it fails to address the potential for pathogen transmission from contaminated materials, violating infection control standards and environmental protection laws. Another incorrect approach is to treat all potentially contaminated items as general waste without proper containment or labeling. This is a failure to recognize and manage biohazardous materials appropriately. It poses a direct risk of exposure to infectious agents, contravening regulations designed to protect healthcare workers and the community from biological hazards. A third incorrect approach is to dispose of sharps in a manner that does not involve a puncture-resistant container. This is a critical failure in sharps management. It directly violates regulations aimed at preventing accidental punctures and the transmission of bloodborne pathogens, creating an immediate safety hazard for anyone who might come into contact with the waste. Professional reasoning. Professionals should approach medical waste management by first understanding the specific categories of waste generated in a dental setting. This includes identifying sharps, biohazardous materials, and general waste. They should then familiarize themselves with the clinic's established waste management plan, which should be based on federal, state, and local regulations. When faced with a waste item, the decision-making process should involve asking, what type of waste is this? And what is the mandated disposal procedure for this specific type of waste? This systematic approach ensures that all waste is handled safely and compliantly, minimizing risks to patients, staff, and the environment. Question 20. Upon reviewing the patient's chart and preparing for an intraoral examination, you notice the patient expresses significant discomfort and reluctance when you approach the area of their upper right canine. The dentist has indicated that a thorough examination of all teeth, including the canines, is essential for the current diagnostic assessment. How should you proceed? Option A. Suggest to the patient that they might not need to have that specific tooth examined today and that you can inform the dentist of their reluctance. Option B. Tell the patient that the dentist needs to examine the tooth and that their discomfort is not a primary concern for this part of the exam. Option C. Immediately proceed with the examination of the canine tooth, assuming the patient will tolerate it as part of the necessary procedure. Option D. Gently explain to the patient that the canine tooth is important for the dentist's assessment of their bite and overall oral health, and ask if they would like you to try and make the examination as comfortable as possible. The correct answer is D. Gently explain to the patient that the canine tooth is important for the dentist's assessment of their bite and overall oral health, and ask if they would like you to try and make the examination as comfortable as possible. Explanation. This scenario presents a professional challenge because it requires the certified dental assistant, CDA, to balance patient comfort and autonomy with the dentist's treatment plan and the need for accurate diagnostic information. The CDA must recognize that while the patient's preference is important, it cannot override the clinical necessity of examining a specific tooth, especially when it is a canine, which plays a crucial role in occlusion and aesthetics. The CDA's role is to facilitate patient care and support the dentist's diagnostic process, not to make independent clinical judgments about the necessity of an examination. The correct approach represents best professional practice because it prioritizes patient well-being and the integrity of the dental examination. By gently explaining the importance of examining the canine tooth for the dentist's assessment, the CDA upholds the ethical obligation to provide comprehensive care and support the diagnostic process. This approach respects the patient's feelings while ensuring that essential clinical information is not withheld. It aligns with the CDA's scope of practice, which includes assisting the dentist in examinations and procedures and maintaining patient cooperation. An incorrect approach that involves immediately dismissing the patient's discomfort without attempting to explain the clinical rationale fails to uphold the principle of patient-centered care, could lead to patient dissatisfaction and a breakdown in trust. Another incorrect approach, such as proceeding with the examination without any attempt to address the patient's apprehension, disregards the patient's comfort and autonomy, potentially causing unnecessary distress and violating ethical guidelines regarding patient consent and cooperation. Finally, an approach that involves directly questioning the dentist's judgment or suggesting alternative diagnostic methods without being asked would exceed the CDA's scope of practice and could undermine the dentist-patient relationship. Professional decision-making in such situations involves a tiered approach. First, acknowledge and validate the patient's concern. Second, provide a clear, concise, and clinically relevant explanation for the necessity of the procedure. Third, offer reassurance and explore ways to minimize discomfort. And fourth, if the patient remains resistant, communicate the situation to the dentist for further guidance. This systematic process ensures that patient care is both compassionate and clinically sound.